Lysosomal storage disorders, or LSDs, are a group of inherited metabolic diseases. Each is caused by one or more mutations that results in the deficiency or malfunction of lysosomal enzymes. Lysosomes are organelles within cells that contain multiple degradative enzymes, which serve to break down different types of biomolecules. In most LSDs, due to the reduced activity of functional enzyme, the lysosome's ability to break down complex macromolecules is impaired. These large, undigested molecules then accumulate within the cells, eventually leading to cellular and tissue damage. LSDs are progressive and over time may lead to increased disability and premature death. For these conditions, timely diagnosis is important in respect to optimal disease management. To assist with accurate diagnosis, dried blood spot (DBS) testing is available. DBS tests are easy to use, inexpensive, and reliable for testing if the following simple guidelines are followed. Firstly, all data fields on the DBS card must be completed for each patient. Dried blood spot specimens are obtained by collecting and applying whole blood to specially designed specimen collection paper. In patients over a year old, whole blood is most commonly collected through a finger prick. The blood should be applied to each circle on the DBS card. The blood should cover the whole circle. Laboratories may also accept samples collected by standard venipuncture. Blood can often be collected in EDTA tubes, but the performing laboratory should be firstly consulted. Collect venous blood in a collection tube and immediately invert the tube to mix the additive. Blood can be transferred using a pipette under the appropriate safety equipment. Hold the pipette tip above the center of a circle close to the surface but without touching it. Gradually discharge the blood and let it soak into the paper, filling the circle completely with a single application. Repeat the procedure for all remaining circles of the filter paper. Incorrect sample handling may lead to false positive results or sample rejection. Therefore, make sure the blood is properly collected. To preserve enzyme activity, samples must be dried at room temperature for at least 3 hours, away from direct heat or sunlight. To avoid cross-contamination, do not stack cards. Cover samples after they are dry. DBS specimens are classified by the International Air Transporter Association (IATA), the World Health Organization's Guidance on Regulations for the Transport of Infectious Substances, and by the International Civil Aviation Organization as a non-regulated exempt material. This makes DBS easy and safe to be shipped by regular mail when your local regulations and institutional policies for packaging and labeling are followed. DBS-based tests enable quantification of enzyme activity and easy sample collection. Positive DBS results should be confirmed as per local guidelines, often by either enzymatic activity on white blood cells from venous sample or tissue and/or genetic analysis of the suspected lysosomal storage disorder.